Good afternoon, everyone. Dr. Barber, would you do our introduction initially?
I would be happy to. Good afternoon, everyone, and welcome to our weekly Black Health Trust webinar. We are so happy that you chose to spend some time with us as we discuss today new breaking COVID-19 info. As usual, this was not a quiet week, and we've got plenty to talk about. We are joined today by our founder, Dr. Randall Maxey, my co-moderator, Dr. Ivan Walks, and also Dr. Hines, who premiered with us, I believe. Time gets away from me, but I think it was last week. And we have as a guest today, a return visitor, Dr. Haywood Brown. So without further ado, I turn it over to Dr. Maxey.
Thank you very much. And we also have joining us to provide information is Dr. A pharmacist who is with us a lot, who's going to provide information on the new Merck pill. And we're going to be very interested in hearing from him. So we're going to go in the order of Dr. Haywood Brown first, and then we're going to go to our other speaker later. And hello, Dr. Hines, how are you?
I'm great. How are you this afternoon?
Good, good. Okay, Dr. Haywood Brown, would you introduce him, please, Dr. Barbara?
I will be happy to introduce my friend, Dr. Haywood Brown, who is a native of North Carolina, having matriculated at North Carolina A&T, doing his residence medical school at Wake Forest and his residency at UT Knoxville, that's University of Tennessee, Knoxville, then doing his maternal and fetal medicine residency at Emory. I've come to know and respect Dr. Brown because of a lot of things that he's doing, but probably the number one thing that I respect him the most about is his dedication to the well-being of Black mothers and children. He has served tirelessly at NMA, as have many of us. He has served at Duke and is currently, and I have to read it because it's such a long title, Senior Associate Vice President of Academic Affairs for University of South Florida Health and Vice Dean of Faculty Affairs, Morsani College of Medicine. Not the least of which, and I don't want to forget to say it, is he is a past president of the American College of Obstetrics and Gynecology. So you should feel comfortable that we are hearing from a true expert in the field of maternal and fetal medicine. Dr. Brown.
Thank you so much. Okay, so I can share my screen again, right?
Yes, you can.
All right, do you all see it?
Yep.
Yes, sir.
Beautiful. Well, first of all, thank you to all the individuals from the Black Health Trust for inviting me to come on this topic again. I know when I hear from Barbara, 2 or 3 days before something, it's like, I need you to do this right now. And I said, well, it so happens that I was preparing a presentation anyway that I'm giving to one of the NMA regions. And so this was part of the presentation. And I've actually added some things to it because the focus really for me today is to talk to you all about pregnancy, but also talk to you about the general statistics and obviously the concerns that we have about the misinformation that pregnant women are getting on taking the vaccine. And of course, the CDC just released something new just this past week. And it really does help us to kind of codify this even more about the importance of it and so forth. So I'm going to begin this presentation, I think I'm on slideshow, by what I'm doing in the community in general to help to educate communities of color. And so one of the things that I've been doing is sharing with them this information. And so when you're trying to get people to kind of appreciate how we got to have a COVID vaccine and what their skepticism is, I really try to share with them Black folks' contribution to vaccines. And so this is a slide that I put together that many people don't realize, and maybe they do, that Cotton Mather, who was a slave owner and preacher, when he had this slave named Ominous, who had smallpox in Africa, and really shared with them how they prevented smallpox in Africa. And lo and behold, Cotton Mather in 1721 did this inoculation of the people. As you all know, George Washington inoculated all the soldiers. People are whining about Secretary Austin saying all military people need to be vaccinated. Well, George Washington did it, so why is it not good enough for our guy to do it in order to keep our people safe? That's historic. That's powerful. We learned the art of vaccination or inoculation from a slave. Then let's bring us to Henrietta Lack. Everybody saw the movie. Many of you understand the movie, but the contribution that this woman made to modern medicine and modern research, even when she and her family didn't know they were doing it, was powerful. So in 1951, when she was 31 years old, she died of aggressive cervical cancer. And one of the things that you all don't know is I'm into disparity in women's health and doing a lot of education right now on cervical cancer and cervical cancer disparity, and how Black women are still acquiring cervical cancer more quickly and also getting less treatment. But that's not the story here. Her cells were amazing. And these HeLa cells contained multiple copies of the human papilloma 18 virus. Believe it or not, the HPV virus causes cervical cancer. And it was responsible, she's directly responsible for the HPV vaccine, if we think about that. Not to mention the fact that when Jonas Salk was doing his work, her cells were being reproduced at who? Tuskegee Institute. And that's where he did the successful trials to develop the polio vaccine. So I know I'm talking to a physician audience, but also talking to a community. And it's so important that we pass these messages on to those individuals who are reluctant for any reason. We did the work. The lead scientist who worked to develop the Moderna vaccine was Dr. Corbett, a physician at the FDA. So again, let's talk reality is. We can claim credit for this vaccine. And I would hope that we would not be doing anything based on our history that would hurt people. Hurt people. Now, this is what my concern is. So this is recently hot off the press. And this is what we should be concerned about. Because the lowest uptake of the vaccine, again, is who? You know, we're up to about 45% where people have at least had one dose for Black people. It's about 69% here. We know what's going on with the people in America and what their reluctance is. And I struggle with the fact that we still have the lowest uptake, started out with the lowest uptake in earlier this year, and really are now just about 45% of Black people who are eligible for the vaccine are getting it. So as of September 21st, nearly 2/3 of the people who had taken the vaccine were white. Blacks, you can see there. We have Latinos who fall behind, Asians and so forth and so on, who at least had one dose, and Native people and so forth. So this is so important for us to understand. And the pregnant community is following the lead, quite honestly, of society. And this number, if you break it down by age, is not that 65-year-old group like me, because we well above for Black communities, well above 65 to 70%. It really is at 18 to to 60-year-old group, 18 to 50, really where the paucity is. And that's where the challenge is. And it really, really, really is very difficult because we understand what the problems are if we get it. And this should be alarming in our country, as you know. We just toppled 700,000 deaths here in the United States. I'm not very good at math, but the reality is that our current statistics show that we are having a death about every 500 residents, especially now with the Delta variant. Our neighbors are dying. Our church members are dying. Our young people are dying. And so sadly, pregnant women are dying. My colleague at the University of Mississippi, Michelle Owen, who's a maternal fetal medicine person like myself, and I'll show you the data. When you talk about 10 pregnant women in the last 8 to 10 weeks who died at her hospital, and she's traumatized. She has been working 24/7, trying to take care of people who have not bothered to take care of themselves. Not bothered to take care of themselves. So, but we are ethical people, and we're going to work as hard for any and everybody to try to keep them alive. That's what we do. So now, 232 million cases and 4.7 million deaths worldwide. Us in the greatest country in the world who has access to the vaccine for everybody who wants to take it, we're now over 700,000 deaths. So that is my concern as a healthcare provider. Now, my next door neighbor is an internist. He actually practices at TGH as part of our faculty. He's on the Covet unit this week at night. And when he comes home in the morning, as I'm getting ready to leave, he is just so overwhelmed and so burnt out, because when he has to put a 33-year-old Black man on ECMO who may not survive the ICU, who, quote, has no risk factors, that is overwhelming to us all. So this is what is recently published, and this is since the surge of the Delta variant. You can see, we were celebrating back here. And of course, what happened was Delta really hit around June and July and early July, and you can see how these numbers just went up, and the number of cases getting up again to 600,000 cumulative cases. And you can see what happened here and so forth and so on. And at the same time, you could see who wasn't getting the vaccine. Who was not getting the vaccine by state. I think you can see that. That slide, it's not showing well for me, but you can see that what we're seeing here is, I'm here in Florida. Here I am, I was just in North Carolina. But look at this right here. This is Mississippi and Alabama. We know about the nutty people up here in North and South Dakota. But this is our Senator Joe Manchin, who's fighting. I'm not going to get political here. He got people dying in West Virginia. He need to be figuring out how to get them the vaccine and not trying to figure out how to destroy the Biden agenda. So anyway, that's all the politics I'm going to do today. But you get it. People need to do what's right and we are doing everything we can on the healthcare side, but they need to do what's right. And if they do what's right, then we have a fighting chance. Now, some states that I pulled up, and I included Florida and I included Mississippi and Alabama because these are people that I've been interacting with quite a bit lately. So Alabama, 2,806 daily average. This is recent daily average of cases. Population isn't that big. 7-day average deaths about 125. They've already had over 750,000 cases and 13,000 deaths, and still going up. But you do know who is fully immunized in Alabama, don't you? The entire Alabama football team and all the coaches. Because guess what? That's what the coach said we're going to do. And the Alabama said, we want to win another championship. We want money. So they ain't having no problem with 100% of the players and coaches being vaccinated because that's what they're doing. And they made the ruling that the students need to be vaccinated if they're going to go to the game. So the people not getting the message are the people who are trying to go to the game, you know. In Texas, and I ain't gonna talk too much about Texas other than the fact that I have 3 siblings who live in Texas, 2 in Dallas and 1 in Houston. My sister who lives in Houston just got her booster yesterday, on Friday. 11,000 deaths, 11,000 cases in the last 7 days, 308 deaths, 4 million cases overall, 62,900 deaths overall, and their governor don't want the school children to wear a mask. What's up with that? What is up with that? Now, I think that it's malpractice, as any governor would be, and we got other issues there. And then there's Mississippi, which I've already told you about my sad, sad cases there with my friend Michelle Owens, who is taking care of 10 pregnant deaths in the last 2 months. Pregnant women, not vaccinated for whatever reason. And you all know the population of Mississippi. Many of these individuals are certainly women of color. And this is a concern we have. And I've already shared with you about Florida. So I've been doing my bit for the community. This was during the COVID vaccine, COVID testing. And in the early days, when we were getting people tested, and I'm sitting there in that hot, hot sun, Barbara, in all of my regalia here. And I'm telling you, we were in the Black community, and people said it'd be like, these people were showing up. We went there to the 22nd Street Clinic. I had people who were walking up. I had people who were, coming up in wheelchairs, who were Black. They wanted to be screened. I had Latino people coming up with multiple people in a car, and we basically screened them. My son happened to be in town at the time because he was a displaced actor, and he was, he needed to come and live with me here in Tampa for a while. And so, and you have to forgive the fact he's wearing a Duke shirt rather than an A&T shirt. He has one of those too, though. I worked at Duke. But he went out there, he got tested, and lo and behold, I put him at the desk. I put him there being a runner, testing, taking the bags, putting it in the bag, and so forth and so on. And I said, if you're going to be here, you may as well do something. And so that's basically, I know the community, and I know how happy they were for us to do this. Worked in the vaccine clinic in the early days. And of course, we had a whole forum, and Barbara knows this, along with my good friend Kevin Sneed, who's the Dean of the School of Pharmacy, where we actually opened up the clinic at Marsani to the community. The goal was to reach Black and brown communities in Tampa for testing and vaccination. And we had an overwhelming response working with the public and also with advocacy partners. And so that really was very, very important to us. And one of the advocacy, so here I am with Kevin, and this is Dr. Sneed, Dean of Pharmacy. This is the 2 Saturdays that we had This is Dr. Deborah Austin, who's in public health. And we brought the church people, we brought everybody people. We were there for a long, long time getting people vaccinated. Very important, because that's the kind of advocacy we were trying to do here in Tampa. With a lot of people, you know, I don't mind sharing the wealth with anybody. And we partnered with the community advocates to increase awareness in the communities of color. These are all former professional football players who retired in Tampa. This is Jerry Bell, my good friend, who was a tight end with the Tampa Bay Bucks. I think one of these guys played for Detroit and one played for Chicago. So we're working with them as well. You know, we had one player on the Bucks who was not vaccinated to get to 100%. Happened to be, you know, someone who's now vaccinated. And of course, who was responsible for calling him out and saying, you need to get vaccinated? Well, these men did it. And so that's the power, and that's what you can do in communities. And I know we're talking to a lot of people, you know, who are in the community. Again, if you're on this program, you know, you have a responsibility as well to kind of share that. So this past week, we've been reviewing the vaccine mandate and what it means for healthcare workers. And so, yes, I am flying United to Europe in Christmas, because United, they fired all the people who won't get vaccinated. So I'm actually okay with that. 99% vaccination rates. They are at 100% when they get rid of the 600 employees who refuse to get vaccinated. Why does it take that? But in reality, it is. So on September the 9th, when the Biden administration presented a 6-pronged action plan to deal with COVID and his response, it talked about healthcare workers. Now, sadly, at TGH, we're struggling with how to get those, get up to the additional 20% of our healthcare workers who are not vaccinated. Fortunately for me, in the medical school, I only have one physician who has not been vaccinated because of whatever reason. And so he happens to be a psychiatrist. Nothing bad about psychiatry, but he's been doing telemedicine. So he's trying to say, well, I'm only doing telemedicine, so why do I have to go to vaccine? I said, well, you know, I said, why do you want to be the only one? Only person. And so that's kind of my bad cop job that I have to deal with, Barbara, that you don't know about, when I'm trying to help people to come to grips. And you know what we're dealing with our governor here, and how many lawsuits he's had and will continue to have. And so all of our hospitals, the requirements for large companies to follow OSHA, and you all are familiar with the safety and health, workplace safety. If you are around not vaccinated and you are breathing, and there was a case recently, they had some woman on CNN where her father, who was recovering from hip surgery, got COVID from his nurse who wasn't vaccinated. You know, that ain't right. Here he was, not there with COVID at all, getting ready to be transferred to rehab, and lo and behold, the nurse wasn't vaccinated. That's irresponsible, not to mention malpractice. And so this is the ruling. The rule will also require that large companies provide paid time off for vaccination, OSHA jurisdiction, private sector, limited application to the public sector. And the bottom line is this, and I'm gonna show you a slide at the end why this is important. Because if you're a facility that receives money from Medicare and Medicaid, and how many facilities do? None. And you don't follow this, your facility is going to be penalized. And so this is the reason that hospitals have to do what they have to do. So this mandate is based on Medicare, Medicaid, in collaboration for the CDC, emergency regulations requiring vaccination for hospitals, for nursing facilities, for ambulatory surgical centers, for dialysis, and we have some healthcare and healthcare agents. Well, people have decided, well, I'm not quit. Well, the good news for me is that they quit their job. They're not likely going to get another job in healthcare. And the other issue is they're not likely going to get a job, maybe even at Public, because Public has required that all their employees get vaccinated. And I'm just waiting for Walmart to decide that you can't work at Walmart unless you've been vaccinated. We need them to stand up. You're one of the largest employers in the country. And I got a feeling that that's going to be coming, and hopefully coming soon. Now, why did I mention the Medicare, Medicaid things again? I follow a lot of things, and this is kind of a history lesson for me. Philip Lee just died. I use this a lot when I'm talking about Medicaid expansion. So he was the US Secretary of Health under LBJ in 1965. You know, LBJ basically created Medicare, the federal health care insurance program for Americans 65 and over. Well, how did he get the hospitals to do it? It required racial integration of any hospital that wished to receive Medicare funds. So I just see the vaccine mandate for hospitals based on Medicare and Medicaid again as a way to say, either do it or lose your funding. Either do it or lose your funding. Where did he encounter resistance? Of course, in the South. But by February 1967, nearly 95% of all hospitals were compliant because they wanted the money. And you all know what disproportionate share dollars are. You take care of poor people. Based on your Medicare, you get disproportionate share dollars. And so they realized that Medicare played a very big role in desegregation of hospitals. Now, I must admit, the hospitals were still kind of segregated, because when I trained at Grady, there were two identical towers, one for the black folk, one for the white people. You know, you all, if you ever been in Grady, and of course now they have a new Grady, but when I was there, it was clearly, you know, that was the way it started in 1965. And when I got to Charity in New Orleans, they were still identical towers the same way, even though we were fully integrated. The same thing held true with Medicaid in 1965. It was designed to provide access to mainstream healthcare for individuals and families. And again, this was all about low income. 32 states adopted Medicare before the first former Confederate state did. Again, now I know we live all over the country. I've been practicing in the South a long time. And I share these statistics with people because where are we struggling now with Medicaid expansion? In the Confederacy. Well, I should say the former Confederacy. Isn't that right? Isn't that right, Ivan? Let me just kind of make sure I'm talking about the former Confederacy and not the new Confederacy. Now, wink, wink on that one. COVID and pregnancy. And this just came out. Protect yourself and your baby from COVID-19. Get vaccinated. And this is getting to the questions that Dr. Neighbor Stevenson has posed to you that we're going to answer at the end. What are the risks of COVID in pregnancy? Well, my colleague at the University of Mississippi knows it's death. Mm-hmm. Long-term morbidity and mortality. About 40% of the people are now having the long-range symptoms for variant. They're basically, you will all know about them. We don't hear about them, but the reality is these chronic lung disease, all types of different things that are happening to people, memory loss, their inability to smell forever. We also know that the data, and we learned this from China in the early days, is associated with prematurity and stillbirths and miscarriage. Now, I'm going to show you some data at the end. These are for people who get COVID in pregnancy, not who get the vaccine. What are the risks of the COVID vaccine? It's shown here, there is currently no evidence that any vaccine, including COVID vaccine, causes problems trying to get pregnant. I told my nephew and all those people who didn't want to have the vaccine because they were afraid that their sperm cells were going to go away and all this kind of stuff. I said, you already got 2 kids anyway, you don't need any more. So basically, maybe you do need to have a drop in your sperm count. But that's not what happens. And so stop listening to crazy people and just do what's right. Low risk for allergies. Yes, you have the same side effects of myalgias and low-grade fever, but the myth is there is no sterility and infertility when you get the vaccine. COVID-19 vaccination in people who are pregnant or breastfeeding builds antibodies, just like tetanus does, that protects the baby. And I'm telling these people all the time, when you take the baby home and Uncle Joe comes by and he ain't been vaccinated, he's just putting you and the baby and everybody at risk. Right. So either don't let Uncle Joe come by to see the baby, or make sure that Uncle Joe's vaccinated and you be vaccinated as well, so your baby's protected. So we have to use all kinds of things in order to help people to understand what the goals are. That's really the reality of it. Now, here's the analysis of the data. And I know we have an audience here, and I know I'm getting close to my time, so I want to make sure that I do this. This was the data that CDC published that we have reviewed now in my societies. This is the first 2,500 women who received this mRNA vaccine before 20 weeks of pregnancy. The normal miscarriage rate is about 11 to 16%. This study showed that the miscarriage rate after receiving the vaccine prior to 20 weeks was around 13%. And what is that? That's similar to the general population miscarriage rate. And so these were safety monitoring studies, did not find any safety concerns for pregnant people who were vaccinated late in pregnancy or in their babies. In fact, just like we require pregnant women to get tetanus now, as you know, Barbara, they basically are getting protection for their child. So the CDC in pregnancy recommends vaccine for all people aged 12 and older, including people who are pregnant, who are lactating, who are trying to get pregnant now in the future. And when the last time I worked the vaccine clinic, I was happy enough that I saw 2 people who were breastfeeding who were coming in for their second dose. These were 2 women, one whose baby was just 4 weeks old. She was coming in for her second dose. She had gotten her first dose during her pregnancy. Vaccination is the best method to reduce maternal and fetal complications from this virus. Counseling should include data on vaccine efficacy and safety during pregnancy and lactation. And you got to talk to people so that they understand that. Provider counseling has been shown to have significant impacts on vaccination and pregnancy, just like providers counseling on smoking cessation. We used to do this and say, if you really, they could tell whether I was genuine or not on wanting to have a pregnant woman to stop smoking compared to some of my residents at the places I was. Because residents would say, well, I don't really think she's gonna stop smoking anyway, I don't think she's gonna lose weight anyway. I don't give her, and they could tell the difference if I was doing the counseling. And data has shown if you counsel people genuinely, that they will hear you and talk their language. And we need to have the counselors have some concordance with the individuals from various racial groups. Barbara knows I'm big on that. The CDC updated guidance on 9/24 just a week ago. Boosters for all people aged 18 to 49 with underlying medical condition, and pregnancy is included as an underlying medical condition because we already told you now that if you get pregnant, if you're pregnant and you get COVID, your risk is a lot higher. The number of pregnant people infected with COVID has been rising in the last several weeks. This is primarily due to the Delta variant. And what did it say? The low vaccine intake among pregnant patients. The increased risk of severe illness and pregnancy complications related to COVID among pregnant women makes vaccination for this population more urgent than ever. So these are the questions that I pose. Is COVID-19 a dangerous disease during pregnancy? Yes. Pregnancy is an independent risk factor for COVID morbidity and mortality. We have an immune deficiency when you're pregnant to some degree, so you're much more susceptible. And, you know, God bless my mother when I became an obstetrician. She died in her 90s, and she said, I know more OB than you do. You know, that's what mothers are. And she said, even I know that if anything's going to ever happen to you, it's going to happen to you while you're pregnant. Bad things can happen to you pregnant. And she used to tell my sisters that. That's why you got to take care of yourself. So she was the best doula I could have had in my practice if she was into that kind of stuff. Because she said, yeah, you need to tell that woman she needs to do so and so, because if she gets sick, she could die. You know what? She got that. And many grandmothers do, and many great-grandmothers do. That's why we need the family to help the woman to understand the issues. No, the vaccine is not dangerous, and it provides this passive immunity to the fetus. Does it matter at what point during pregnancy that she receives the vaccine? No, anytime. I've already shown you the data on women who got it at 20 weeks. I've shown you before 20 weeks, and the women who've gotten it later in pregnancy. What side effects can I experience? The same as non-pregnant individuals. You'll have a copy of this. This is a little tic-tac video that we actually put together in our clinic with one of our pregnant patients and pregnant residents. And she basically wears her t-shirt in the clinic, and she shows her arm and so forth and so on. I never can figure out how to get these things to play. And this is my final slide that my son, who's in public health, has been helping me work with. We're big sports fans, so I don't want to offend anybody with this, but here's the deal. Now, I know LeBron James has gotten some criticism from the people on The View because he didn't sing to the world, you know, I'm going to force you to get vaccinated if I'm an NBA player. Now, he at least got vaccinated, and he was skeptic, and he told the public about it. And so now 93, 94% of the NBA is vaccinated. My former Dookie, you know, he only spent 1 year at Duke, so that explains a lot, who's refusing to get vaccinated. If he, you know, he's willing to sacrifice his entire salary because he plays in New York, he ain't gonna be able to play any home games in New York or in California. But you know what? As my brother said to me, he also believes the world is flat. So what am I supposed to do? You know, and then of course there's sweet Nicki Minaj, which many people are listening to her music, but don't listen to her conspiracy theories about the vaccine. Don't. What she and Tucker Carlson are spreading about people's testicles are swelling up is just bull. They may be swelling up for chlamydia, but they ain't swelling up because of the vaccine. And so this is my message to you all today. We've got to squash those vaccine skeptics, and we've got to stop listening to crazy people and so forth and so on. Now, one other political thing, you know, I just don't know. And of course, you ought to know that you're wrong if Ted Cruz is supporting your position. You ought to know, because hear anything about you. And he's from Texas. So with that, I'm going to stop. Thank you all so much. I really appreciate being able to generate this. And I would say something, stand up, go to church, talk to people, and get them vaccinated. When I was at Duke, my final thing is, you know, I was very close to a lot of people, you know, many of the environmental service workers. And quite honestly, some of them were skeptical to get the flu vaccine. And they would say, well, Doc, what do you think about that flu vaccine? They're going to make me take the flu vaccine, and I'm not going to be able to work at Duke. I said, well, do you want a job? Or do you not want a job? I said, so what is the deal? So I actually got together with a bunch of my nurses who worked at the hospital. Guess what we did? And, you know, we do go to church. We decided to have flu shot Sunday at church. And you know what? Many of the employees got in line. Because my point was, you ain't gonna get fired because you ain't gonna take a flu vaccine. Come on now. It's gonna be that for people in general who work in the environments that the president's mandate calls for. So thank you all.
Thank you, Dr. Brown. We appreciate your astute talk. And are there any questions in the chat for Dr. Brown?
Yes, there are some questions. I'm going to ask Dr. Hines if she'd be so kind as to manage, because it's really a fairly complicated question. Oh, I'm sorry, you can't see it. I'll go ahead and read it the way it was sent. You can't see it. Okay, so this is there are two questions. The first one has two parts, and I'm just going to read it. I can't paraphrase. Which do you consider to be a more legal option under HIPAA rules? 1, mandating one's COVID test status, negative or positive, assuming a standard PCR nasal swab, or 2, mandating one's, or mandating deprivatization of medical record information, given that one's vaccination record is a part of one's medical record? That's the first question. We'll deal with that one first.
Okay, so basically, you can never violate HIPAA when it comes to those of us who recognize that. And so what is in the person's protected file, you certainly can't use it against them. And even in Florida, and so that would not be the way to do it. We are asking people about their vaccination status. And of course, they have to show that vaccination status if they're a healthcare worker under the mandate. And so in Florida, it's a little bit more complicated, as you know, because our governor says you can't ask anybody about their vaccination status, particularly even our students, because you can be charged $5,000 for each person you ask if they report you. Now, that's Florida. But in reality, under the mandate, you have to show proof of vaccination and in order to work in the facility. Of course, we're testing people and their families when they get to the hospital. And we also are testing, we also offering the vaccine to family members. And so if a person is in the hospital and they have been tested positive for COVID, quite honestly, that's still part of their record. And technically, you cannot go broadcast that to their next door neighbor or anybody else. I think that answers your question. But your hospital does have to follow the OSHA regulations of workplace safety.
The second one, thank you, Dr. Brown. The second one is, why were pregnant women excluded from the early clinical trials by Moderna and Pfizer and J&J before they applied for the EUA?
Great question. Again, when we're learning new things about in pregnancy, keep in mind that pregnant women, we are the most unstudied clinical trial group of any population, because you're worried about a patient and a passenger. And so you really would never include them early in a trial with these vaccines. That came later because of the issues that we have. But fortunately, there were many people who volunteered for the trial, and we also had data on those type of things. Remember that anytime even though this is an mRNA vaccine, rubella, you don't give rubella to pregnant women, because it's potentially teratogenic. And so this is the reason that pregnant women were not included in the initial trial. But enough of them got the vaccine in that 2,500 women that we studied to know, and more are now rising, and that we actually have the information on the protection. The next question here is about the Merck pill. It is an antiviral, a very potent one, just like acyclovir, and it will not pose any concerns for pregnant women who get, in fact, much more appropriate for them to get it, just like we do if they were to get varicella pneumonia. We treat them with high-dose antivirals because it's also very deadly, and also if they get disseminated herpes virus, we basically use acyclovir antivirals. This antiviral.
We're actually going to have a brief talk on that on our next speaker.
Okay, yeah.
So Dr. Johnson Hines and Dr. Walks, are there any other comments or questions for the doctor?
Well, that was one about medical mistrust, and that's why I showed this last slide here. Who are you going to believe? you're going to believe Nicki Minaj and Kyrie Irving, or you're going to believe your trusted healthcare provider and going to believe the fact that no one, George Washington's slave, Henrietta Lacks, or the woman who helped develop the vaccine, who's a Black woman, why would we want to lead you astray? That's the only thing I got to say about that.
So let me make a comment. First of all, Dr. Brown, thank you, and thank you, and thank you. This is just so helpful. And you know, the young folks talk about keeping it real. I think you've kept it real, real, real. And I think the challenge that I have is that we don't get to decide what people influence us to do point by point. We tend to look at people as those who influence us. And in today's parlance, they're actually called influencers, right? So Nicki Minaj is an influencer. And great, she may let people know what kind of music to listen to, but she's being influenced as well. And
Absolutely.
That I think is something we have to really accept, is that these folks are being influenced by people, not because they're crazy and stupid, but because they have a goal. And that goal is good old American money. The
Absolutely.
more followers you have, the more you're an influencer, the more money you make. And we just have to accept that that's the world we live in. So when LeBron James stands up and says, not only did he get vaccinated, but he had his family get vaccinated, that's going to influence some people as well. So
Absolutely.
I think it's an uphill battle. I think we are winning the uphill battle as people are getting vaccinated. And you know, I pray for Kyrie Irving that he doesn't get COVID and doesn't have any long-term consequences. And I pray for all the rest of us that we don't listen to him around COVID-19. Now, his crossover, we should listen to him, but the rest of it, no.
He may just sail off the end of the earth because he believes it's flat. You know, whatever.
So one thing, my observation is, these people who are influencers, they get paid more for controversy and negativity than they do for going along with the program. So it's important for them to be negative. They get money. Dr. Hines, what's your take on this?
I was just going to add that, especially with regard to LeBron James, I actually appreciate his response, because the entirety of his response was, while he said he didn't feel like it was his job to tell everyone to get vaccinated, he went on to say that he felt that it was appropriate for him to speak regarding his personal experience and what he advised his family to do, which in my opinion is appropriate, because on the one hand, we can't say, hey, superstar, when you agree with us, we want you to chime in on medical matters. But hey, superstar, on the flip side, Nicki Minaj, when you don't agree with us, right, shut up and be quiet. So I appreciate LeBron's perspective on saying, I'm going to leave that for the medical professionals, because in many ways, that's really what we want people to do. Listen to the right people for the right information. And the other thing I just wanted to add with regard to vaccine mandates and HIPAA violations, it's not new or unique. I worked in occupational health for a long time. It's not new or unique to require proof of vaccinations, proof of antibody resistance for a whole plethora of different types of jobs, but in particular for healthcare workers. That was a routine part of a lot of pre-employment physicals, was to prove that you were either immune to certain diseases or had vaccinations for certain diseases. So that's not a new phenomenon at all.
Well, thank you. And so my son, again, worked public health in Indianapolis, and he was all over it yesterday. He said, you know, Dad, these people are committing suicide. And he said, Black folk who go to church believe if you commit suicide, you ain't going to heaven. And I said, well, I don't really think that that's really true. So he said, but you all need to use that as an argument. They're out there, they basically are running out and they're committing suicide when they don't get the vaccine. I said, well, I'm not going to necessarily put that on my portfolio that I'm going to say that, but it's a good thought. Maybe we can use that for some of these people who are calling for that religious objection to get the vaccine. And I said, even the crazy judge down in Texas, the guy who owns one of the biggest mega churches that was a Donald Trump fan, said there ain't no religious objection to getting the vaccine. He said that's not in the Bible.
I was watching a news program, and they had a teacher in New York, and they were on her, and she was saying how she is refusing to get the COVID vaccine due to a religious objection. And the interviewer asked her, and she said specifically, "You're Jewish. Can you tell me what part of your Jewish beliefs is, gives an objection to getting a COVID vaccination?" And the lady never answered the question and just spun right around it, because to your point, like, that's not, so what is unique about the COVID vaccine to the Jewish community that is different than the other vaccinations? Like, is rather can be not to, but again, when you get put on the spot, which I also think is where we also, when we're talking about our vaccine hesitant people, when we're talking to them and counseling them, I think that one of the first places that in general we want to start with is asking them, what is your hesitation about? What is keeping you? And then on the flip side, is there anything that could happen? Is there any information that you could get that would allow you to consider getting a vaccination? Because that understanding those two things for lots of people is going to help guide your conversation, because lots of times we want to start counseling with the information we think you want, or we think that you need, which isn't necessarily addressing what the individual's concerns are. And I thank you, Dr. Brown, because you address a lot of the common myths related to, pregnancy, fertility, breastfeeding, timing. A lot of those are the very common myths that keep people from being in that particular.
Let me ask you a question regarding the overall view. What do you think the motivation is for the purveyors, not the messengers, the purveyors of the misinformation to mislead communities of color? I don't believe that these people are all ignorant, unintelligent, and dumb. Do you think that there is some larger purpose they're trying to serve by making misinformation prevalent against our people?
Particularly, this is about they don't really care whether you die or not. That's the way I look at it. One less Black voter if you vote. So I think that's really the whole motivation. They could care less if Black or brown people die. What's getting their attention is they don't really care if white people die either, because of the message that they're giving. And so they're killing off their own voters as well. But in reality, for us, we cannot fall victim to that stupidity. Just as we are about voters' rights, that's why it takes people like ourselves, who are part of the community, to be able to say, come on now, let's do this. So one final thing here, and they're using all kinds of ethical things, how Black folk were, enslaved, and how Tuskegee. So one of my colleagues down in Sarasota called me one morning, and he said one afternoon he was in clinic, and he was seeing an 18-year-old Black girl and trying to get a woman who was trying to get her vaccinated. And he said to her, she said, well, that vaccine is just experimenting on people, just like Tuskegee. And people always want to bring up Tuskegee, a totally different thing. And he said, well, what do you know about Tuskegee? All I know is they experiment on Black people. And I said, well, she said, I wanted you to tell her this, Doc. Say to her, syphilis caused a slow death. And most people who got syphilis had more fun getting it. But for her, that COVID is a fast death. And in reality, the morbidity, because you can't really argue with people when they bring something up like that. We know, and I said, I probably would have made it real like that with her. She probably would have still ignored me, maybe reported me. I used to say to my residents, I said, you're going to tell this patient the right thing. If they complain about you, I'm the boss. They're basically going to be complaining to me. So we just have to do the right thing, Dr. Maxey. We just have to continue to do the right thing and preach the message.
So,
Thank you.
so let me just make one last comment, Dr. Brown. You brought church into this. So I know Reverend Pointer is gonna be mad at me about this, but I'm an usher at my church. And today I was ushering. It was first Sunday. We have people register in advance. Only vaccinated people should come and what have you. So a young man walks in and he starts to pull out his vaccination card to prove he's been vaccinated. And I said, thank you. He said, well, aren't you requiring proof? I said, no, we're not requiring proof. But if you want to come to church and lie about being vaccinated, there's somebody else who's going to get you. I don't have to get you. If you want to come into church and lie, you go ahead and do that. But I don't think anybody lied this morning. But I think it's important when we are working with people that we set things up to help them. So having people register early, letting people know only the vaccinated people are being invited to come back to church in person, having hand sanitizer, a lot of things that we can do to make people comfortable, because we don't see everybody's vaccination card. We don't know if it's real. And so we have to be able to encourage folks in a way that's positive, all the things that have been said so far. And at the same time, Dr. Maxey's mantra about common sense comes into play. I know I haven't seen you at church in a year, but I'm not trying to hug you right now. I'm trying to wave at you, right?
Yeah.
I'll leave it at that.
It's
Thank
so
you
funny
so
that
much.
you say that, because we had to, Dr. Matt, I didn't like all the doing flu season and stuff like that. You know, you go to church and everybody want to kiss you and hug you and so forth and so on. And I used to be like, no, I grew up in the church like that. Everybody kissed you, but we had to stop kissing people. So anyway.
So, Dr. Brown, you have been fantastic. We thank you for being here. And if you want to take your tie off and stay on a little bit longer, that would be absolutely great. But we're going close to the place where we have to wrap up. Simon, I want you to show the video
Off. And Barbara, give me a
gonna,
call. Thank you.
I will do so.
and then I want to introduce our next guest. I want to show the one on Active Pure. We have a device, and several companies have agreed to assist financially the Black Health Trust. And we've had them present to our Wednesday night meetings with our medical advisory. And there are two videos that I want to show during the course, one right now on a system that can potentially purify the air of coronavirus and other agents. Pay attention, and then we'll go to our next talk.
The virus that causes COVID-19 and other pathogens are reminders that bad air can kill. You want protection to keep you healthy and give you peace of mind, but you won't settle for just any protection. You want the best out there. Active Pure. The Active Pure system has origins in the NASA space program. It's even been inducted into the Space Foundation Hall of Fame. Active Pure is used daily by hospitals, schools, sports arenas, restaurants, government buildings, homes, and more. So how does it work? The Active Pure system dispatches invisible supercharged submicroscopic particles at tremendous speed. The particles collide with viruses, bacteria, and other nasty things and immediately turn them into harmless byproducts. Active Pure works immediately on both air and surfaces. It comes in portable units built for any space, from gigantic ballrooms to elevators. It's affordable, easy to install, and virtually maintenance-free. It's like invisible personal protective equipment, or PPE, for you and your pets. Sounds too good to be true? Independent FDA-compliant lab testing has shown that within minutes, Active Pure neutralizes more than 99.9% of pathogens, including the virus that causes COVID-19. The Active Pure Medical Guardian, powered by the same Active Pure technology as our other products, has been cleared by the FDA as a Class II medical device. There's only one Active Pure. Beware of claims for other systems like HEPA, bipolar ionizers, and UV light. They are passive and slow. Some trap pathogens, but don't destroy them. In fact, many of them are so dangerous people can't even be in the same room while they operate. No system cleans the air faster, safer, or more effectively than ActivePure. To give your family and your customers peace of mind, choose ActivePure, protecting lives with air you can trust. To get ActivePure for your home, office, store, or organization, go to www.valera.com or contact your local distributor.
So thank you very much, Simon. We have a connection with this company. Anybody who has interest can write to the Black Health Trust to social@Black Health Trust, and we'll make sure you have the information. And I'll ask Mr. Herb Dorsey to put information into the chat about contact. But we believe that this can be very helpful for those of you with churches, schools, homes, etc. Our next guest is Dr. Lamont Gibson, who is a retired registered pharmacist. And we know that over the past week, there's been a lot of news about a new medication produced by Merck. It's not a vaccine, but rather an antiviral agent that is orally taken. And we believe that it can help save lives by cutting the death rate by up to 50%. Is that true, Dr. Gibson?
Well,
what's the story?
Actually, to your point, the phase 3 trials showed efficacy of up to 50% in terms of preventing death. So we're not talking about another vaccine here. And that is point number one that I have to bring to the attention of everyone on the call today, is that it is not, I repeat, it is not something that should be interpreted as an alternative to vaccination, because that is the one way for us to minimize the awful consequences of this viral infection called COVID-19. Having said that, I have to reach back and give credit to our presenter today, because he did a lovely treatment on how important it is for us to appreciate the actual heritage in vaccination medicine in this country that dates all the way back to Onesimus, a slave. Think about that, a slave. I think he is the one who should get credit for bringing to the attention the importance of vaccination, all the way to Dr. Kizzmekia Corbett, who led the charge in creating the Moderna vaccines. These are important in addition to other vaccines that are part of good healthcare. We talk about health inequities and that sort of thing in the Black community. Well, we don't keep up with our vaccination schedules because we have a number of vaccinations that are not only required, but if you have a passport and you use it, you're going to have to get those vaccines before you are able to board a plane to travel out of the country. So I would posit that not only should we be concerned about COVID-19 vaccination, we're looking at the flu season. It's here, it's now. We really, really, really do need to make sure that we emphasize the importance of getting flu vaccination in addition to COVID-19, while we look at what we need to do in terms of keeping current with our other vaccines, because there are vaccines that should be taken at various times in our lives. Those are not talked about enough. What I did not do a presentation for you with slides and such, but I will say that if you take a look at the chat, there are links that you can use to go to and visit sites that can tell you about the molnupiravir, which is the antiviral that was mentioned by Dr. Maxey and Dr. Brown. It's important for us to understand that this treatment does not replace vaccination, and it will not prevent the kind of illness that vaccination can prevent for you. They did mention that the phase 3 trials, this, by the way, it doesn't enjoy emergency use authorization just yet. So that is of note, and we need to be aware of that before we get too excited about it. But more importantly, it's important for us to understand that this medication, the molnupiravir, is an antiviral that inhibits the replication of the code that actually provides antibody protection in COVID-19. So it's not quite the same as the mRNA or the adenovirus protection that's available in the Pfizer, Moderna mRNA and the adenovirus of Moderna.
Dr. Gibson,
yes.
A lot of people have questions about when you use it, how you can get it, and they're not able to see the chat because of the way they may have called in. So if you tell us what's the information that we need to know about this particular new treatment. I understand it's not to replace the vaccine, but what actually is it done? How is it used? Where do you get it? What's the story?
You can't get it just yet because it does not enjoy emergency use authorization. So this is not something that you can ask your doctor to prescribe right now. It just had incredible results in phase 3 trials. 2 Sundays ago, one of the listeners asked about, well, should we wait on preparation of vaccine boosters because perhaps they may come up with some formulation that would be more effective against variants. Well, the way things are done in the pharmaceutical industry is we have this process that's iterative. We have clinical trials, and peer-reviewed medicine, evidence-based medicine dictates that we stick to that process and that we have these sequential steps and watch what happens with those, and the data is returned and analyzed so that we can, well, in the case of molnupiravir, the Merck product that is a topic of conversation today, that medication showed actually 50% efficacy rate in preventing death and serious consequences. That's with patients that are in fact burdened by the sort of underlying conditions that have been used to describe African Americans and other people of color. Now, I think it is of note that when we talked about patients, to Dr. Wilbur Jordan's credit of Oasis Clinic fame, he said that his HIV patients who are on antiviral therapies seem to be faring pretty well in the pandemic. Well, that signaled to me as a pharmacist that there's something more to the antiviral approach. And that's what we see with the molnupiravir treatment, is that they show good promise. And I suspect that we will see more products coming down the pipe because other companies, in addition to Merck, like Pfizer, are working on antiviral preparations. So in essence,
what I understand, correct me if I'm wrong, is that this new medication, when it becomes available, will be taken within 48 hours of exposure, and that it consists of several doses per day of multiple numbers of pills or tablets or capsules or whatever it comes in. But it is something that you can't wait 10 days or 2 weeks, but it should be taken within 48 hours. Is that correct?
You just stole my thunder. As a matter of fact, that is correct. It should be instituted immediately, as is the case with treatment of other viral infections. Tamiflu, which has been used for a number of years for treatment of influenza, it is most effective when it's used right away, shortly after, if not sooner, diagnosis. And that's the only way that this will, I won't say it's the only way, but it is a way to ensure that you get greater efficacy from the molnupiravir, which is the product that Merck came up with. Does that answer the question?
Thank you. Dr. Neighbor Stevens and Waltz and Hines, are there any questions that you have or in the chat?
I have a question for the group. There's a lot we don't know yet about this new therapeutic tool, which hopefully once they present to the FDA, we'll have access to the actual studies. But assuming that everything is okie doke, assuming that it gets the EUA and it becomes available, I want us to think about I think, large possibility for inequity in access of this treatment. Because there are a couple of things about it that I've been able to find, because I've been kind of trying to check this out. A couple of things about it that worry me. First thing is, this is not something that you can pop down to CVS and get off the counter. This drug will require a physician prescription in order to access it. So Dr. Maxey, you just a moment ago laid out the time line that you need to follow in order for the drug to work. So you got to recognize that you got the symptoms. You got to get an appointment with somebody somewhere in order to get the prescription. And then how much does this stuff cost? Now, we don't know yet what the final word on this is, but according to Reuters, the course of treatment is about $700. So if you are on insurance, you probably will be able to afford it, depending on what the out-of-pocket copay is.
But Dr. Neighbor, if it comes out under emergency use, it's free.
Well,
it's the
that's what
government
we
that makes
thought.
it right.
That's what we thought. But what we are learning is that there is discrepancy occurring in the community about how you can access monoclonal antibodies. I will say that the actual vaccines have been pretty much available to anybody, but there is an opportunity, I am concerned about, for inequity in terms of access to this new therapy. So I'm going to throw that out.
The other thing this reminds me of is the morning after pill. So you gotta know you've been exposed, and then you take something so you don't get pregnant, or what? Dr. Hines, what do you think about this new pill?
So I can appreciate what you're saying with regard to the potential for limited access, depending on obviously your region and testing scenarios. A lot of testing scenarios are set up in a way that you kind of have to go through a provider to get testing. So that could be a natural segue to getting a prescription. So for example, to your point about free, right? When, at least in my area, when COVID testing first came out, before the county had created a more robust program, you had to go through an urgent care center. Well, the urgent care center wanted to charge you the copay to see the urgent care doctor to then get your free test, even if you were asymptomatic. So in some ways that can absolutely present a barrier if you have to go through a provider to get to the test and or to get to the prescription. But the positive side is a lot of places are already set up to facilitate that.
Dr. Walsh, what do you think?
I think people ought to go get vaccinated. That's what I think. I think that we, first of all, let me start off by saying, Dr. Gibson, always a pleasure to hear you, and thank you for your scholarship on these matters. I think that I write prescriptions for patients now, and it's not unusual for a patient to call my office and say, my pharmacy doesn't have that. My pharmacy says that they may get some in next week. So like Dr. Neighbor Stevens, I don't know what the availability is going to be. And I think that we should take things as they're available. So number one, talk to your doctor. As Dr. Hines said, find out what people's concerns are, help them with the answers they need so they can get vaccinated. There was something in the chat about the fact that we know now that people who are vaccinated may be asymptomatic, but could still be harboring virus, could still transmit virus, could still become infected. So we need to just be using the common sense piece of this to make sure that we're protecting ourselves at every step of the way. Now, we find out that we're tested, that we're positive, and we're looking for this medication. Sure, that's the time when I think we need it. That, the monoclonal antibodies, but all of the things in their order. If anybody is listening today and thinking that they may have heard wrong, I listened to Dr. Gibson, and what I heard was get vaccinated first. And then if you still need some treatment because you have acquired COVID-19 as an illness, this is one of the things that's available for you. Dr. Gibson, did I hear that correctly?
That's spot on. That is absolutely correct. Now, to your point, the whole program really should be vaccination, testing. 1, 2, 3. We really can't underemphasize the importance of testing, because now, mind you, with the prevalence of the variants and the fact that vaccination will not necessarily keep you from shedding, it's important that we be aware of changes in our status, because folks that have been fully vaccinated have turned up very, very ill. So it's important for us to get the message out to folks that, you've only just begun, but here's what we have to run. We have to test, and we have to test regularly. It does not give you a pass to go to a football game in person and don't wear a mask, don't wear gloves, none of that, just because you're fully vaccinated. That makes no sense either. There's no common sense in that. What's really most important is not only that you keep up on your other adult vaccination schedules, your influenza vaccine, as well as COVID-19 vaccine. Very, very important. Testing and vaccination.
Well, I think what's happening here is that the common sense mantra is saying, don't get the disease in the first place, avoid it by getting a vaccine. We know that. However, it does raise another question, though, and I'm going to maybe ask Dr. Wilbert Jordan, would this antiviral prevent or lower the rate of transmission? I haven't heard that discussed at all. Am I going down the wrong track on that?
We don't really have enough data. While Dr. Jordan is unmuted, I'm going to take the liberty of actually adding my 2 cents on that one. We're still studying molnupiravir, as is the case with a number of antivirals. So, but to Dr. Jordan's other point, and Dr. Nabert-Stevens, this situation speaks to the need of primary care coverage in the Black community. We need to get more folks familiar with a physician, just like they're familiar with a pastor. We really do need to encourage the enrollment, open enrollment constantly of our people. Then we can address those inequities that Dr. Barbara Nabert-Stevens brought up earlier, because we can catch them and we can get folks diagnosed early enough for something like molnupiravir to be of use. Otherwise, what's the use?
Well, thank you so much. I want to show
Jordan is unmuted.
Dr. Jordan?
Yeah, yes.
I appreciate your comment on, is there any potential effect on transmission expected from this antiviral, which I understand from Dr. Gibson?
That's not what it should be for. I should get the vaccination. That's what we need to be getting people to do. If by chance I still get infected and I'm aware of it, then there is a pill now that I can take to help prevent me from becoming sick. To the extent that I have had sex with someone, kissed and slobbered all over someone, exposed them, coughed, etc., and I'm taking the pill, yes, it should decrease the amount of virus in my system. I should not be taking the pill as a means of not spreading the virus. I should have gotten the vaccination for that. So the pill is another weapon. It's great, but we don't want people to not get the vaccine because that is now a pill, period.
Amen.
Thank you so much. Are there any other questions in the chat?
There is a question in the chat. It looks a little tongue in cheek, but it is, so if they don't trust the vaccine, why will they then trust the Merrick pill? I think that is a reasonable question.
Well,
I don't know the answer. I think it's a reasonable question.
But
Yeah.
well, what I said was, I think that there is, like, we have people who trust the monoclonal antibody treatment that don't trust the vaccine. So the vaccine hesitant group are more complex than sometimes we give them credit for. So it's not necessarily a logical thought process. Like, if, you know, just because you object to this newness doesn't mean you object to this other newness if it falls in line with your predetermined belief system, what you're comfortable with, you know, what your personal experience may be. So it's not it's not science-based. So therefore,
No, it's
not
emotional based.
Yeah, exactly.
And I think it's very hard when it's an emotional based system. I spoke at a high school, the honors class, and not one person in the class wanted to take the vaccine. I asked why. They doing a Tuskegee on us. And just as the doctor said earlier, I asked, what was Tuskegee? Not one person in the class knew what Tuskegee was. And my response was, I don't like white people using the N-word. I don't like Black people using the N-word. And you all have just all used the N-word on me. Do you understand that? Of course, they did not. But I said, next week I'll come back and you all know what Tuskegee was. Only 2 people had the initiative. I said, okay, I will tell you all 2 things now. But this would be an honors class, you're kind of lazy. You should have all gone and found out. You're more apt to do things now than when you finally get to college or grad school. So if you're this damn lazy now, I pity you when you get in grad school. Get off your lazy butts and find out something. I mean, we keep ignoring things. And I think we need to talk about at some point the whole issue of vaccine. People use Tuskegee all the time and they have no idea of what happened in Tuskegee, and they can't translate. To do Tuskegee now would be impossible. All of the checks that you have in hospitals came from Tuskegee. When Tuskegee happened, the white folks didn't ask the Black folks for anything. They went there and said, we're gonna do this, we're gonna watch them, we're not gonna treat them, etc. So you're saying now somebody can tell Randall Maxey that 5 of your patients have syphilis and you're not gonna treat them and you can't treat them. I can't imagine that. So in reality, kids don't understand what Tuskegee was. We don't understand what Tuskegee was, but we need to realize times have changed, period. And there are things now, all of the protection we have, the IRBs, etc., all that really grew out of Tuskegee, just as what the doctor showed earlier, the vaccination program really came from a slave showing the master what to do.
So Dr. Jordan and others, my logic in talking to patients that they don't trust Pfizer with their mRNA vaccine, but they don't question Pfizer with Viagra. They take it, you know.
I got to remember that one.
Yeah. The other thing is, all of us go to Whole Foods, Kroger's, Publix. Who knows what they're putting in your food, but you don't question it. Why do you question something that can save your life? It doesn't make sense. So like you say, it's an emotional judgment, and we just have to find a way to be patient and ask people to look at common sense and reason with them. But if Pfizer, if I was going to get somebody with something, I wouldn't do it with an injection anyway. Maybe I'd give you, put it in your back, in your bottled water, which doesn't make sense.
In your
Put it in a
Viagra.
food, your carrots, your beets, and other things.
So Dr. Maxey, because you are an influencer, I don't want you to keep naming all the things that people are going to be worried about tonight when they go to get in their groceries. What I really do want to emphasize is what Dr. Hines said about the vaccine hesitant folks being a complex group. That's point one. I think we have to understand that people have more than one concern around this issue. And then point two, because I know what I want to tell people about taking the vaccine. What I don't know is what their concern is. And Dr. Hines put it very, very appropriately that we have to ask people what their concerns are so we can maybe have a conversation that's useful. I love saying what I know, but it may be more helpful if I can say to somebody what they would like to know. So those 2 points about the groups being complex and about us actually listening to what people need so we can give them what they need, and then sprinkle a large dose of common sense on all of it. And I think we might make some more headway.
Thank you so much. Simon,
Dr.
can you
Maxey?
show that last video? And then I want to.
Dr. Maxey?
Yes.
While he's queuing that up, I just want to say to our Facebook audience who sent in a question, the name of the Merck drug is molnupiravir. It is spelled MOLNUPIRAVIR. They can't see the chat.
Okay, well, thank you.
Just like it sounds, right? I don't
Yeah.
know why they can't name these things something simple.
Okay. Simon, can you show that video? This is another group that has asked to have our audience see this, and anybody that uses this, part of this money will be donated to the Black Health Trust, and it's something good for your health, that you don't have to go into hospitals and etc.
Sometimes going to the doctor can be a scary thing, especially if it's been a while. Often in senior patients, readings can be normal at home and high at the doctor's office due to anxiety. That is where Instamd comes in. Instamd has an RPM solution designed for senior patients. There are no more erroneous readings as patients are able to calmly check their blood pressure and so much more in the comfort of their homes.
Reading completed and it is normal. Please power off blood pressure cuff.
Now doctors are able to monitor their patients efficiently and daily for better management, making patients become more involved and responsible. The doctor and patients are easily connected, even during a pandemic, with seamless audio and video conferencing. This is a win-win for both parties. SmartHub speaks multiple languages
Lectura finalizada. Parámetros fuera de lo normal.
and auto-connects to commonly used blood pressure monitors, pulse oximeters, scales, glucometers, and much more. With more available data and clear communication, the doctor and patient can understand each other more efficiently. What does that mean for you and your practice? Your practice benefits with better patient care, patient commitment, and increased income, with Medicare's average monthly reimbursement per patient being $200. There is zero cost to patients. Instamd will benefit your practice. We have FDA-approved devices that seamlessly connect patients to the practice. Many other features including automation, billing, reporting, and analytics. This simply makes Instamd the best choice. Do try Instamd today.
Well, thank you so much. I am installing this into my practice. I take care of patients all over the country and in certain U.S. territories, and allows me to keep up literally with their pulse, with their temperature, with their diabetes, and other things. And it allows me to be on top of. So for those of you who care for patients at a distance, This would be very good, and for patients who are hesitant to expose themselves with officers, it's good. It also helps keep your patient unnecessarily from going to urgent care and emergency rooms. I thank our guests, Dr. Haywood Brown and Dr. Lamont Gibson, for their information. And I thank our co-moderators. Let's ask if they have last words. Dr. Hines and Dr. Walks and Dr. Neighbor Stevens. Dr. Hines first.
I think this was a good, robust discussion on the things that are keeping people from getting vaccinated and making sure that we talk to our patients, members, community members. There's some very boots on the ground examples of ways to target those groups. So it's good to see the positive work that other people are doing.
Thank you. Dr. Walks?
I don't have much to say in terms of additional comments. I think today's conversation was what was really useful, and I'm gonna get back to Dr. Brown later about his comment about psychiatrists.
Yeah, I wondered about that. I want to use this opportunity, my last words, to remind this community that as we observe the somber occurrence of the fact that 700,000 Americans have died as a result of COVID-19, of that number, African Americans make up about 14%, or about 67,000. So we need to do what we advocate on this show all the time. Use common sense. Get vaccinated if you're above 12 years of age. Wear your mask. Socially distance. And above all else, use common sense.
Well, thank you. And I certainly appreciate everything that our program has been able to do. I remain convinced that the real problem here is greater than a medical problem. It is a political problem. And it is, in reality, a program to suppress by death the Black vote. And that's my opinion. We believe that people should listen to common sense and listen to trusted messengers. And we thank you very much for joining the program today. We'd love for Dr. Pointer to have final comments and take us home, if you would, sir.
This is another outstanding Black Health Trust. I don't know. Every Sunday, we are blessed to be together. So it is just a real gift. Dr. Hines, you're a welcome addition to our family. And your fresh frankness is really helpful. I'm just flabbergasted, and I love an intelligent Black woman, because all of what I am is from intelligent Black women. So thank you so much. Dr. Brown, we are grateful because the information that you shared with us today is going to be meaningful as we're talking to our friends, family, and acquaintances. Let us then look to the Lord to receive his blessing. Enter my heart, O Holy Spirit. Come in blessed mercy and set me free. Throw open, O Lord, the locked doors of my mind. Cleanse the chambers of my thought for thy dwelling. Light there the fires of thine own holy brightness and new understanding of truth. O Holy Spirit, very God, whose presence is liberty, grant me the perfect freedom to be thy servant today, tomorrow, evermore. In Jesus' name we thank you. Amen.
Amen.
God bless everyone.
Amen. Thank you. Have a good rest of the day, everybody. Be safe and use common sense and get vaccinated and get the booster. I had mine 3 weeks ago.
Thanks, everyone.
Bye.
Bye.
Thank you for Simon, our technician and producer.